First and foremost, when you were explaining, you talked about genetic
testing.
Yeah.
Yeah.
And then what does that mean? Does it mean that it probably runs in the gene? I don't understand.
Yeah.
I'm not a medical person.
Just to explain in layman terms, when we're all created, we started as a cell. We're actually made up of different cells in our body system. I'm sure everybody understands some bit of biology. All right. So in the cells, you have the DNA, which determines your gene. So what determines that you are black or white, or you are big or fat, or whatever it is, comes from the gene. All right. So it means that because that's the normal way we look, it means there are some things that may not come in that normal way that might cause some abnormalities that you now want to check. So for example, for all humans, we have what we call 23 pairs of chromosomes in our body system that makes up the DNA. Now in some conditions, you may have some people that have, instead of having a pair, you now have three, all right, on that pair, making it what we call a trisomy. That's you have like 3 copies of that particular chromosome. So conditions like people would have heard about it, Down syndrome, which means that what we call in our own medical terms, say trisomy 21, which means on chromosome 21, there's like an extra chromosome in that area. So it creates a defect. So it just creates an abnormality. And of course, when the baby starts growing up, that's when you start seeing those abnormalities. So things like Down syndrome, I don't want to bore you with so medical terms that we learned. Sometimes we have to even bite our tongues to learn those learn those things in medical school. But the truth is, those are very, very real, and they are children that are couples that give birth to children that way. So it means that if there is a possibility to now check and make sure that we don't give birth to this with children who have these abnormal disorders or these genetic disorders, yes, it could happen. Now the other aspect that is very common in our society today is what? Sickle cell anemia. All right, and we know that sickle cell anemia has a lot of challenges where you have people growing up in pain, having to have repeated hospital admissions because their blood level is low, always feeling sick with joint pains and things like that. Now, in the past, what we tell us in churches are ASAS don't get married or don't even just get close to each other. But we know that has changed now, which means that the fact that ASAS does not mean you cannot give birth to children that are AA or AS. What you need to now go through is what we call genetic testing. So it means because children come from embryos, or babies come from embryos that are generated when the sperm and egg meets in the womb. So once those egg and sperm, when they meet and generate an embryo, you can test those embryos, all right, by that process I call genetic testing. So it's called pre-implantation genetic testing, so we call it PGT for short, where you can now test these embryos and find out, is this SS, is this AA, is this AS, all right, and you can transfer healthy embryos, and that risk is removed completely.